Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy channel, and especially the today's class is related with the subject of Prasuti Tantra and Stri roga. Why I am saying this Prasuti Tantra and Stri roga? Because paper 1 is of Prasuti Tantra, that is related with the pregnancy, delivery, and post delivery. All these phases, starting from the Garbhadhana, union of the male and female gamete, then 9 months, then Garbhini Paricharya, then actually the delivery process, and then also the post delivery, that is called as a Prasuti. I am repeatedly telling you there are two words. Till 9 month, Garbhini. After 9 month, what you can say, the woman is called as a Prasuti is a delivery, but then Sutika. Yes, I am sorry. Ayurvedic word is a Garbhini and Sutika. Garbhini and Sutika. Garbhini before 9 month, and after 9 month, that after delivery, the lady is called as a Sutika. Please write down these two words. Garbhini, Garbhini, Garbhini till 9 month. And after delivery, please write down the word Sutika, Sutika, and say 10 times Garbhini Sutika, Garbhini Sutika. Okay, so this is paper 1. And then slowly and steadily we are discussing a lot of points from the paper 1. But after paper 1, if we finish within 1 month, next 2 weeks or 3 weeks, then we will start the paper 2, that is related with the gynecological problems. Okay, so my dear friends, before starting today's topic, you write down the title. For example, today is the 12th of December 2023. You write down 12th of December. Then you write down this title, abortion or miscarriage. This is very mishap or very sad news for the pregnant lady, for her husband, for the family. It's a shocking. If something happens like this, abortion or miscarriage, that is not a good thing for the pregnant lady. Okay, so we will discuss it. But before that, I will once again tell you the important 10 topics from paper 1. First topic, Garbh Vijnaniya. Second topic, Garbhini Vijnani. Third topic, Garbh Vyapad. Fourth point, Garbhopadrava. Fourth point, Garbhopadrava. Fifth point, Prasava Vijnana. Prasava is a delivery. Prasava Vijnana. Sixth title topic, Prasava Vyapad. Anytime, Vyapada is a complication. In Panchakarma, a lot of time there is a Basti Vyapada, Vamana Vyapada, Vyapada complication. Vyapada complication. So, Prasava Vyapada. Seventh topic, Sutika Vijnana. That is after delivery. It is called as a puerperial period according to the modern language. Puerperial period. That is Sutika Vijnana. Eighth topic, number 8, Sutika roga. Ninth topic, Mood Garbha. And 10th topic, Kutumba Niyojana or family planning. So these are the important topics from paper 1. Garbha Vijnaniya, Garbhini Vijnaniya, Garbha Vyapada, Garbhopadrava, Prasava Vijnaniya, Prasava Vyapada, Sutika Vijnana, Sutika roga, Mood Garbha, and Kutumba Niyojana. Today, first we will see the modern aspect, and if the time permits, then I will discuss Ayurvedic aspect also about these conditions. So I request first you write down, I'm sorry, I will mark for you so that you can concentrate what I am talking about. First you write down this word, miscarriage. Miscarriage, here, cursor, you see the cursor. In Ayurveda, it is called as a Garbhasrava. Please write down Garbhasrava, miscarriage. And then abortion in Ayurvedic term by Sushruta, it is called as a Garbhapat. MUHS university question, there are questions on Garbhasrava and Garbhapat. So miscarriage and abortion. let us talk starting about discussion this thing. What is miscarriage? Miscarriage can be, is not actually the physiological, it's also the pathological, but it may not require the type of the, it is a little bit different than the medical or surgical abortion. I'm sorry, here the word is not correct. I am apologize for that. Please excuse me. Miscarriage is actual naturally occurring event. That means it doesn't require any other external influence like medical treatment or surgical. It is automatically coming out, but that is not physiological. That is not, it occurs naturally, but it is not physiological because it is pregnancy is disturbed. Pregnancy is disturbed, so it is not physiological. Yes, it can occur naturally. A miscarriage may also be called, there is another word, spontaneous abortion. Automatic, spontaneous abortion. That means the baby comes out. Okay. Miscarriage is the spontaneous or unplanned. There is no planning. Expulsion of a fetus from the womb. Womb means uterus. Before, when it is coming out, before it is able to survive independently. The child, the baby, the fetus is not able to survive outside, but it is get out, expulsion from the uterus. But what is abortion? Abortion is a procedure purposefully to end the pregnancy, end of pregnancy. Both are bad. Both are very sad things in the life of a woman, in the life of a husband, in the life of the family. But in abortion, one can use medicine or surgery to remove the embryo or fetus and the placenta from the uterus. So the doctor has to do something special things for the medicines, for the surgery. But miscarriage, actually it is automatically that is expelled out. It is not physiological. It is occurring naturally, but it is also pathological. Both is pathology. Miscarriage, pathology. Abortion, pathology. Both are sad things. Both are bad things. Okay, let us see. Types of the spontaneous abortion. Okay, threatened abortion, inevitable abortion, incomplete abortion, complete abortion, missed abortion, and recurrent or habitual abortion. I think before we proceed further, these 6 names, please, you can write it in your notebook. I will wait. I will wait. I will dictate also. First is a threatened abortion. There is a threat that, okay, it will now expelled out. Threatened abortion. Inevitable, that we cannot prevent. Inevitable, non-preventable. We cannot stop it. Inevitable. Then incomplete. It is not complete. Some placenta is remaining back and incomplete is there. Then complete abortion. Then missed abortion and habitual or recurrent abortion. Some unfortunate ladies are there because of some this and that. We are going to see the reasons. But first pregnancy, abortion. Second pregnancy, again abortion. Third pregnancy, again abortion. Oh my God, why this is happening? Why the baby is not retained in the uterus? That is the question in front of the family, in front of the lady, in front of the husband. And then they visit to the doctor after 2 abortions sometimes. And then they found that the os, that opening in the lady is loose. It is not properly tight. Then the doctor, gynecologist, they make a stitch that is called as a os tightening. Please write down this word, OS, os tightening, TIGHTENING. Os tightening when the os is incompatible. It is not very much good elasticity. It having the less laxity is there. Muscle tone is not proper. And because os is not tight, the expulsion takes place. So this is the important reason for habitual or recurrent abortion. Okay. So let us talk detail about this, all the things. I hope you have written down 6 points. Threatened abortion, inevitable. You can write down inevitable, cannot prevent, incomplete, complete, missed, and habitual abortion. Now we will go further. Now, causes of spontaneous abortion. Here we are going to discuss step by step causes. Why this is happening? First is idiopathic. Please write down. Idiopathic means cause is not known. Nobody can tell why this is happened. But why? No cause is found. That is called as idiopathic. Please write down. Idiopathic, no cause is found. No cause is found. That is idiopathic. Cause not known. Why has this happened? Nobody knows. Then fetal factors. Because of some baby inside the uterus, it has some problems. For example, chromosomal anomaly. Anomaly is a pathology. Chromes, genes, they are defective. Chromosomal anomaly, that is defective genes. Then, what is that? Splitted ovum, some problem in the ovum. Then herediform mole. You just hear these words. I know detailed explanation. Sometimes, if the time permits, I will going to explain you these particular terms. But at the moment, we don't have that much time to define each and every term. I can prepare some notes on it, and I can put it on my channel's explanation, etc. PDF, or you can WhatsApp me. I will send you the detailed meaning of each term. Herediform mole, degeneration of the villi, multiple pregnancy. That means there are 2 babies, 3 babies, and congenital defects. So these are the causes of the baby, but because of these problems, miscarriage can occur. Next, the maternal factors from the mother side. General, these are more important than fetal because these are more common than the fetal causes. So you must remember the maternal, mother causes. For example, mother may have some general or systematic problems. Infections. The lady, pregnant lady, can get some infection. So she may suffer from high fever, hyperpyrexia, that is high fever. Then she may suffer pregnancy, malaria. Pregnant lady is suffering from malaria. Jaundice, hepatitis. Syphilis, that is a venereal disease. Because husband has got syphilis because of the visiting to the prostitutes, and husband gives that venereal disease to the his wife. That is syphilis. Syphilis is one of the venereal disease. Then septicemia. Septicemia, again, amia is a blood. That pus or the infection spreads through the blood. That is called as a septicemia. Then herpes simplex virus. Herpes infection is there. Toxoplasmosis. This is again a type of the infection, toxoplasmosis. Okay. Then some diseases or disorders to the mother, to the pregnant lady. She may have the blood pressure. This is commonest cause. Hypertension is common cause for abortion, miscarriage. Chronic nephritis, kidney problem. Diabetes mellitus, that is madhumeha. Thyroid problem, hyperthyroidism or myxedema. PCOD, very common problem nowadays. Polycystic ovarian disease. Multiple cysts are there in the ovaries. Severe hypoxia. Because of some disease or because of the lung problem, she has a less oxygen. Hypoxia is oxygen is less in the blood. Surgery, the lady may has to go for urgent surgery or trauma by traveling by rough road and by scooters. So trauma is very common. For the abortion, miscarriage, there is important reason you write down as a trauma or accidents. Traveling, write down, traveling on the rough road. This is very common, very common. Then progesterone deficiency. Progesterone is important hormone, remember, for the pregnancy. You know, when the menstrual cycle is there in the first year BMS, Kriya Sharira subject, you know the menstrual cycle. Estrogen and progesterone are the important hormones in menstrual cycle maintenance. But for the pregnancy, progesterone is more important. That's why whenever there is a repeated abortion, habitual abortion, then the gynecologist, they give injection Proluton depot. Please write down the name. Injections Proluton, Proluton, Proluton depot, DEPOT. Proluton depot is a brand name. And what is the content? This is the content, progesterone. So these progesterone injections are given by the lady doctor to the pregnant lady to maintain the pregnancy. Okay. Some drugs, if the patient is taking some medicines for anti-malarials, anti-convulsion, epileptic attacks, anesthetic agents. So these medicines also can cause as a complication miscarriage or the abortion. Okay, so these are all causes we are discussing of miscarriage and abortion. Next, that genital system, reproductive system may have some problem, like for example, local factors, sthanika, local, uterine anomalies. For example, bicornuate uterus. These pictures, I request all the students to go on the Google images and take or write down as a search bicornuate uterus. So you will get some image. So collect all the images, study by yourself and keep it in your mobile and see repeatedly, okay, this is the cause of miscarriage. Bicornuate uterus, septate, there may be septum, diaphragm, septate uterus, retroversion at the end of first trimester, submucous fibromyoma, a tumor, cervical incompetence. Just now I have explained that. Cervical os is not competent, is not tight. Cervical os, that is mouth of cervix, that is incompetence. It is non-elastic and it is what you can say, the tone is very less, and automatically from cervix to the vagina, miscarriage occurs. Surgery during the pregnancy, for example, myomectomy. If there is some problem in the breast is removing, then sometimes appendix attacks takes place to the pregnant lady, appendicitis, then appendicectomy, sometimes ovarian cyst removal. In all these procedures, there are chances that the pregnancy get disturbed and miscarriage can occur. Local trauma, anything can happen. Okay, next we will go further. Now this is a simple small chart to explain or comparison in between these types: threatened abortion, inevitable abortion, incomplete abortion, complete abortion, and missed abortion. So here we will see clinical findings. What is the size of uterus, internal os, that is cervix, and USG, that is sonography, ultrasonography. So whenever there is a threatened abortion, that means there is a fear that now something will go wrong. It's like a warning, threatened. The lady gets fear, family gets fear, threatened abortion, because abortion may take place, but it's not sure. So there will be only slight bleeding. Uterine size will be normal as per, you will not understand this word. Please write down. GA is not general anesthesia. No. Here, GA is equal to, please write down, gestational age. See the cursor, black cursor. GA is equal to gestational. GESTATIONAL. Gestational age. That means uterus size. First month, 2 month, 3 month. From the pubic symphysis, it will go up to the umbilicus of the pregnant lady. In the 6th, 7th, 9th month, it is at the level of umbilicus. Okay, so that will be normal because it is not complete abortion has taken place. Internal os closed. That is better. Because then expulsion will not occur. If you do the sonography, live fetus is still alive. Subchorionic hemorrhage, little hemorrhage will be there. So this stage, one can do very good treatment and abortion can be avoided. It can be stopped. Okay, next is inevitable. No chance. Bleeding, lot of bleeding, pain will be there. Patient may be in shock, unconscious. Blood pressure will drop down. Pulse will be feeble and tachycardia, fast pulse, but feeble, very weak. Then uterine size as per the gestational age or maybe less. Internal os, bad luck. Open with products felt, amniotic fluid, the fetal head, all can be felt by the doctor. Okay, so internal os open is a bad sign. And when you do the sonography, bad luck. That is the dead fetus. So this inevitable abortion, we cannot do anything. Doctor will say to the family, I'm sorry. I'm sorry. The fetus cannot be survived. So it is irreversible. Can you see? This condition can be reversible. Pregnancy can be continued after the threatened abortion if the proper treatment is given immediately. But inevitable, no chance. It is lost. Okay? Incomplete, there will be also bleeding. Uterine size will be smaller than the expectation. Internal os is open. Bad luck. Incomplete. Abortion is taking place. And why it is incomplete? But because there are some retained products inside the uterus. Some placental pieces are there. It is not completely coming out of the uterus. All the matter is not coming out, so it is called as incomplete. Now, what is complete? When the abortion totally complete, then naturally bleeding will stop. Uterine size will be smaller. Internal os, because it is, why it is closed? Because totally fetus, amniotic fluid, placenta, everything is out. Finish. Process is finished. So again, the internal os will be closed. Ultrasonography, there will be nothing inside. Empty cavity, empty uterus, totally gone out. That is complete abortion. Fifth is a missed abortion. So bleeding will be absent or minimal. Uterine size will be smaller. Internal os will be closed, but unfortunately, dead fetus. It has not coming out, but the fetus is dead. So in the missed abortion, one has to complete the process of abortion. Rather, doctor will induce the abortion, and that will be the fetus will be taken out because it is dead, no use. So in all these 5 conditions, only first condition there is a reversible. Pregnancy can be maintained. I'm not saying 100%. Okay, let us discuss further in detail. Now in detail we will go. First we will discuss about the threatened abortion only. Concentrate on the threatened abortion. Okay. What are the clinical features, symptoms? Choreo-decidual hemorrhage has commenced means started, but has not progressed to the stage of irreversibility. That's why I am saying threatened abortion. Threatened abortion can be managed by doctors. There are a lot of hopes. The family will be little bit praying to the God, please, continue pregnancy. In threatened abortion, yes, it is possible. Yes, it is possible. Pray, and doctor will do all the efforts. Symptoms, how we will diagnose that it is an abortion? Because the lady has started the pregnancy, amenorrhea more than 6 weeks. Okay, scanty and fresh vaginal bleeding, mild uterine cramps, little bit pain will be there in the abdomen, and backache. What are the signs? Doctor, symptoms are always expressed by the patient and signs are detected or examined by the doctor. Soft uterus and soft cervix, internal os is closed, that is cervical os is closed, blood present at only external os. So doctor will do, first he will check the hemoglobin, packed cell volume, blood grouping will be done, ultrasonography, uterus will be seen bulky, gestational sac corresponds to the duration of amenorrhea, blood clot round that particular area, urine pregnancy test will be positive. So what doctor will now do? He will ask the patient, give the suggestions, give the instructions, avoid lifting heavy weight. Don't do that. You are the fear of abortion, but now you can save your pregnancy. Avoid strenuous activities, physical activities, and sexual intercourse, not allowed. complete bed rest. Because if the lady, her husband, family, they want that baby should be survived, 9 months should be completed, then they should do all these things. Ambulation only after bleeding ceases. Ambulation means movement, movement in the house, for the toilet, for the all the normal rituals, eating, some bathing. That can be advised whenever only singles, no bleeding. Absolutely, there should not be a single drop of blood. Then only she is allowed to move little bit here in the house, not outside, not outside. But bed rest can be the bed rest instruction can be little bit less. Then here treatment. Can you see this RX? RX is always prescription. RX. Can you see here? It's a prescription. Human chorionic gonadotrophin injection. HCG. I will wait. You write down the full form. Write down the full form. HCG. Can you see the cursor? Please write down. I am dictating you. Human, HUMAN, human chorionic, CHORI, chorionic, ONIC, gonadotrophin, GONA, gonado, trophin, TROPHIN, human chorionic gonadotrophin, HCG injection, 5,000 international units. IU means international units per week. Every week this injection is given. Next, another treatment. Micronized progesterone, 200 to 400 microgram till 14 weeks, nearly about 3 months, 3.5 months. Okay. Follow up sonography will be repeated to rule out if the abortion is progressing to the inevitable or missed abortion. So constant watch every after 3-4 days or minimum week, the doctor will ask, do the sonography, check it out, whether that particular whole process will going further or it has been stopped. This is a reversible. Threatened abortion is always reversible. Okay. My dear friends, let us move slowly further to check the new things. Okay. Now we will discuss about the inevitable abortion. Inevitable. We cannot prevent. The process of abortion has progressed. आगे आगे चलते हैं to the stage or extent of inevitability or irreversible. No back. Abortion will take place, whatever you do. So there are no chances that the pregnancy will continue. Sad news, bad news to the lady, to the family. Symptoms, again the same, amenorrhea, that is stopping of the menstrual cycle, amenorrhea. Profuse vaginal bleeding, because everything is coming out. Pain present with the fresh blood and clots. Pain will be there, abdominal pain, cramp, like the labor pain. Uterine contractions present. In Ayurveda, please write down the word. What is what you can say, the spasmodic type of the pain during the delivery, labor pain? The Ayurvedic word. I want Ayurvedic word. Please write down. Avi. Sir, what is that? A, double A, V, W-I. Avi. Avi. Labor pain. Labor pain. Avi. Labor pain. Avi. Please write down. Simple Ayurvedic terminology. Signs. Symptoms expressed by the patient and signs detected by the doctor. Patient will be anemic, pallor. Doctor can check this. Always anemic patient, you check this conjunctiva. Lower palpebral conjunctiva, there will be no pink color, pale color, white. Then nails, check the nails, anemic condition. Hemoglobin is less than 10 gram %. Tachycardia, pulse rate will be fast. Normal pulse rate is 80 per minute. But this will be, for example, 110 per minute, 120 per minute. But the pulse for the palpation, it will be feeble, weak pulse. Blood pressure, drop down. Hypotension. in spite of 120 by 80 mm of Hg, systolic blood pressure will come down to nearly 60. So 60 by 40 mm of Hg, that is hypotension, blood pressure will be low. So less blood supply to the brain, that is called as a shock. Whenever there is a less blood supply to the brain, it is called as shock, S-H-O-C-K. Very important word in Roga Nidan subject. Okay. Cold extremities, when you touch to the hands and legs, they are very, very cold because blood supply is very less. Soft uterus and cervix, internal os, cervical opening, cervical mouth is opened, clots in the vagina, bleeding is coming, clots. Products of conception, that is a fetus, are felt through the os. The doctor can check that there are some head and all these organs can be felt. Okay. The doctor will ask to do the hemoglobin and pack the cell volume to check the anemic condition. Even blood will has to be BT, blood transfusion has to be given. So naturally, blood group will be tested. RH factor will be tested. Rhesus factor, blood group. Ultrasonography will show bulky uterus. Then lower pole GS, at the lower pole of the uterus, internal os is open. Blood clots in the cervical canal. Now what to do? First, resuscitation with IV fluids, blood transfusion if required. What is resuscitation? To what you can say, the prevent or to give the support to the lady's physiological status, because that is also essential. She is becoming unconscious. She is in a shock. To take out her from the shock, what to do? There should be enough fluids, IV fluids through the intravenous route, saline or dextrose, etc. given. Sometimes if the hemoglobin is too less, then blood transfusion is also given. Pregnancy, if less than 12 weeks, what is that? 3 months. Less than 3 months, then suction evacuation. Suction machine will be put in the vagina and suction evacuation. All the products from the uterus will be taken out. Suction evacuation. But if pregnancy is more than 12 weeks, more than 3 months, that is really abortion. Before 3 months, miscarriage, garbhastrav. After 3 months, garbhapat. To happen that garbhapat or abortion, what doctor do? Lady doctor, intravenous injection of oxytocin. Oxytocin is an injection. Oxytocin is a hormone which is responsible for labor pain. Oxytocin, please write down, this is very important. Previously, we were giving progesterone to maintain the pregnancy in the threatened abortion. But when we see that there are no chances that pregnancy will continue, then doctor will give oxytocin. Two hormones are separate, don't get confused. For pregnancy, we need the progesterone to continue. And when we want to get out that all the products of the pregnancy, then we have to give oxytocin, which will start the labor pain and the normal delivery, similar type of action will take place. Injection, tetanus toxoid, then prophylactic antibiotics. There are chances of infection. Considering the chances of infection, prophylactic means before antibiotic has been started. Then anti-D 50 micromilligram injection is given if the mother is Rh negative and gestational age is more than 3 months. Histopathological examination of the conceptual products, that some products are taken on the slide or the bottle and they are sent to the pathological laboratory to check whether there is any infection in the product or why this has been happened. Okay, so this is an inevitable abortion. Next, we will see incomplete abortion. We are discussing, we will go step by step. This is a third type that we are discussing today. Just give me a few minutes, my dear friends. Okay, can you see? Incomplete. Abortion has occurred, but the process is incomplete. What is incomplete abortion? The abortion has started, abortion has taken place, abortion has occurred, but incomplete. Process is not complete. Os is open, cervical os is open, and contents 50% out, 50% in, partially expelled. 100% products are not out. Some products are remained inside the uterus. Okay. Symptoms, again the same. History of amenorrhea, which suggests the pregnancy. Continuous or recurrent vaginal bleeding. Non-stop. Profuse, very heavy, with passage of products. Lower abdominal pain due to periodic uterine contractions. AV, Ayurveda, AV or labor pain, and expulsion of the products and the blood clots. What are the signs? I'm just taking pallor and shock due to profuse bleeding. So much bleeding that the patient becomes, again, hypotension will be there, pulse rate will be high and weak, and patient may sometimes be drowsy or sometimes unconscious. The shock will be there. Profuse bleeding, hemolytic shock or hemorrhagic shock. Rather, I will say it's not hemolytic, it's a hemorrhagic shock. Okay. Blood volume or the volume of plasma has become less. Products of conception failed. Doctor will check in cervical canal or vagina. Internal os is open. Soft uterus. Uterine size may correspond to gestational age or may be small. So these are all from the clinical features. Now we will see in incomplete abortion what can be done by doctor. Hemoglobin, blood will be checked. PCV, packed cell volume, again for RBCs. Blood grouping will be done. RH factor will be decided. Then total count and differential count in WBC, white blood cell. Total count. Normal count is, yes, 4 to 11 thousands per cubic mm. I am saying white blood cell, WBC. Okay, 4 to 11,000 per cubic mm. If it is more than 15,000, mild infection. If it is more than 20,000 per cubic mm, WBC. I am talking about WBC infection because WBCs are soldiers. WBCs are soldiers. Remember this word. What is DC? In white blood cells, there are two types of the cells, or mainly 5 types of the cells: neutrophil, eosinophil, and basophil. And another 2 are the lymphocytes and monocytes. Okay. Then ultrasonography. Now, what is the management? Resuscitation to protect the lady, because fetus has now gone. We have to take care of the lady, pregnant lady, mother. So there is a resuscitation to avoid the further shock. Intravenous fluids are started immediately. Blood transfusion if anemia is there. Dilatation and suction curettage. This is a specific name. There are some instrument, dilator and curetors. So dilatation to the vagina, to the cervix, and suction curettage. Suction, you know the meaning of suction. Products will be taken out and the process will be complete. This word you are expected to write right now. So I will say this word 3 times. Please write down. In incomplete abortion, dilatation and suction curettage. Dilatation and, write down, quick. Suction curettage. Dilatation and suction curettage. Now, pre-medication, before that, one has to do the pethidine and diazepam. Pethidine and diazepam to tranquilize her. Mind pains will be reduced. Paracervical block, like anesthesia. Paracervical block, 10 ml lignocaine. 10 ml lignocaine 1% is given. This is the anesthetic, local anesthetic. Next. Now we will try to discuss this complete abortion. Complete abortion. Products of conception are expelled completely and uterine cavity is empty. Process is complete. So there is no chance of maintaining the pregnancy, nothing, nothing. This is a sad, this is a bad condition. The family should be get assured. Santvana Chikitsa. In Ayurveda, it is called as a Ashvasana or Santvana Chikitsa. That is called as a counseling. In medical terminology, counseling of the mother, counseling of the husband, counseling of the family is very essential because this is a very sad incident in their life. So, symptoms, history of amenorrhea, no menstrual cycle, and lower abdominal pain, history, because process is complete, history of vaginal bleeding with passage of products, decrease now because products are out, so pain will be slowly reduced, decrease in pain and bleeding, vaginal discharge subsides within a week, total process will complete within a week. Signs, in case of heavy bleeding, patient may suffer circulatory collapse. Shock. Circulatory collapse means shock. SHOCK. Less blood supply to the brain. Soft cervix. Internal os is closed because products are out. Process is complete. So internal os, cervical os closed. Small uterus because everything is out. No mass is inside, no fetus, no baby inside. Okay. Then little bit slightly bulky, minimal vaginal bleeding and GS in vagina. Now, what we can do? Again, sonography to confirm that everything has been coming out. Doctor will give sedative to the patient for two things, for controlling the weakness, for controlling the pain, irritability, and little bit nervousness. The doctor can give the sedatives. Then, if the anemia is there or nothing, chances of anemia, so hematinics. What is hematinics? To improve the blood. Hemoglobin will be raised, RBCs will be raised. Then, as this process has been completed, injection tetanus toxide, TT injection, Dhanurvat, tetanus toxide injection. Then, if the blood group is negative, then anti-D immunoglobulin, anti-D, RH. Curettage only if the bleeding continues or ultrasonography reveals remaining products in the uterine cavity, then only curettage. Curettage is an Ayurveda lekhana karma, is needed. Otherwise, if the sonography is showing that absolute, there is nothing inside uterus, no need of the curettage is necessary. Okay. So my dear friends, I think we have discussed a lot about this abortion, different types of abortion, Garbhastrava and Garbhapat. This is the common question asked in the university examination. And we have discussed all these points very nicely. Now, for last 10 minutes, I can say, I can dictate you, I can give you audio clip explanation with only audio, no screen, there is no matter in front of you. Garbhasrava and Garbhapat, you write down. Garbhastha. Now I am talking about little bit Ayurvedic more about Garbhastrava and Garbhapat. You may be surprised why Dr. Deshpande is speaking slow. Because I am expecting that you, each and every viewer, should start making notes in your notebook. That's why a little bit type of the slow dictation type of the audio. Garbhastrava and Garbhapat. These are asked in the examination. Now we are talking about Ayurvedic approach. Garbhastrava and Garbhapat. So, from Garbhadharana, now more Ayurvedic terminology will be there. More Ayurvedic terms, Ayurvedic words will be there. From Garbhadharana, that is conception, till that particular baby or the fetus has a capacity to live independently after coming out from the uterus. Before that, if the baby is coming out, expulsion is taking place, that is called as, that means before 7 months, then it is called as a Garbhapat. Now there are different terms, Garbhastrava and Garbhapat. I am giving you references. Please write down Sushrut Nidanasthan. Please write down Sushrut Nidanasthan 8/7. Sushrut Nidan Sthan 8/7 or Madhava Nidan 64/2. These are the references. Just I will try to say Sanskrit words. A Chaturthat Tato Masat. A till Chaturthat, fourth month. Chaturthat Tato Masat Prasavet Garbha Vichutihi. Garbha Vichutihi Tataha Sthira Sharirasya. Sthira, stable. Sthira Sharirasya Pataha Panchama Shashthayoho. Panchama Shashthayoho. Sushrut Nidan Sthan 8/7. So, during the pregnancy, from the first month up to the fourth month, from the conception till the 4th month, if that material from the uterus comes out, that is called as a garbhastrava. In modern, it is called as a miscarriage. Garbhastrava till 4th month, till 1st month, 2nd month, 3rd month, 4th month, expulsion takes place, then that is garbhastrava or miscarriage. Because that garbha is a drava more type of liquid. Drava liquid. From 4th month up to the 6th month, 4th month, 5th month, 6th month, there is a little bit solid formation of the baby. And when that solid parts are coming out, that is called as a garbhapat in Ayurveda. Garbhapat or abortion in modern language. Then we will try to discuss about the causes. Ayurveda causes. Number 1. In the lady, there is a description Tryavarta Yoni. Tryavarta Yoni. If there is a structural problem in Tryavarta Yoni, reproductive organs, if they are not good structurally, then this miscarriage or abortion, garbhastrava or garbhapat can take place. Second cause, Ayurveda. If the lady, pregnant lady, takes the Vishama Ashana, eating mammam, spicy, katu, tikta, kshar, and ushna padartha. Katu, spicy, pungent, tikta, bitter, kshar, very strong alkali, and ushna virya, hot substances. Then garbhastrava or garbhapat takes place. Number 3, third cause, Ayurveda. Mithya vihar from the pregnant lady. For example, ati vyavaya, intercourse, ati vyavaya. Next, ati vahana pravas, too much traveling on the rough road. Excessive walking, excessive pravahana. If the lady is suffering from constipation, amoebiasis, and lot of straining, that is pravahana is bad. Pravahana, straining is bad, and garbhastrava, garbhapat takes place. 4th, Ayurveda causes. Manasik hetu, manasik. Krodh, anger. Shok, anxiety, tension, depression. Asuya, jealousy. Irsha, ambitious. Bhaya, fear, phobia. Next, 5th cause, Ayurveda. Aghat, that is trauma. For example, fall. If the pregnant lady is taking something from the top with stools and the stool has collapsed, that is a trauma, fall. Then, shastra, etc. Some surgery has been taken place. Prapidana. Prapidana is like getting pressure on the abdomen by some reason. 6th cause, Ayurveda. Garbhastrava, garbhapat. Poshana janya hetu. Nutritive problems. The lady is doing too much fasting, upavasa, langhana, that is undernourishment. Then improperly some vamana or virechana type of the medicines are given to the lady. For example, if constipation, and if you use the strong Ashwakanchuki, Ichha Bhedi, Naracharasa, these are the three purgatives medicine. Strong purgative, strong virechan. 3 tablets I have mentioned. I will say again 3 names of the tablets for virechan chikitsa. Ashwakanchuki. Oh my God, sir, what is this name? Yes, it is the name of the tablet. You go on Google, Ashwakanchuki, Ichha Bhedi, and Naracharas. Naracharas. 7th cause, Ayurveda. Kala Vikruti. Kala Vikruti. That is Rutu Vyatita Kal. In Rutu Vyatita Kal, if the pregnancy takes place. 8 cause of Ayurveda. Aupasargika Vyadhi. Communicable diseases. Aupasargika Vyadhi and Krumi Sankramana. Infections. Krumi Sankramana. Next. Samprapti of Garbhastrav and Garbhapat. Samprapti pathogenesis. Sushrut Nidanasthan 8/3. What happens? Because of all above causes that I have discussed, nearly 8 causes, there is fetus is losing its contact with the uterine wall. Okay? And then it moves down from the upper abdomen to the lower abdomen, and there is a Koshtha Sanshobha. Koshtha, Ayurvedic terminology. Koshtha Sanshobha, irritation. Irritation will take place in the cervical region. And then Vimargag Apanavayu, because this is under the control of Apanavayu. Parshva, Basti, Adhodara, Yoni. In all these places, there will be Shula. Shula means pain. Anah, gaseous distension. Mutra Sanga, that is oliguria. And then there will be most important is Yoni Gata Strava. Yoni Gata Strava and Garbha Nasha. Okay? Then Samanya Lakshana by Sushrut Sharirasthan. Sushrut Sharirasthan 10/45. 10/45. So what will be there? Purvarupa, for example, Parshva and Prishtha, backache, Shula will be there. Anah, gas in the stomach. Mutra Sanga, this will be there. Then when there is a Rupa, that means all the Purvarupa only indication, warning signals. But in the Rupavastha, Koshta Sanshobha, Yoni Gatarakta Strava, and Garbhashaya Mukha Vistruti, dilatation of cervical os. Okay? Of course, the parikshan is ultrasonography, and you can give the management. In Pururupavastha, admit the patient. First is admission, then bed rest should be there. In Ayurveda, in Sushruta Sharirasthan, please write down, in Sushruta Sharirasthan 10/45, Adhodara Parishek. In Pururupavastha, Adhodara, lower abdomen, Parishek of Godugdh. Parishek means shower of the milk. And then, or Jeshtamada Quat, Jeshtamada decoction. Then expert doctor can put the Yoni Pichu, swab, Yoni Pichu, that is Jeshtamada Siddha Grita or Shatadhauta Grita. Then Pradeha, the paste application on the lower abdomen of Shatadhauta Grita. Internally, there will be Garbhasthapaka Aushadhi Dravya. Garbhasthapaka Aushadhi Dravya. But by chance, this is like a preventive aspect. But if that is inevitable, but if it is this is a threatened abortion. But if it is inevitable, then there will be Garbhashaya Shodhana Chikitsa. Garbhashaya Shodhana and Koshtha Shodhana Chikitsa. Garbhashaya Shodhana or Koshtha Shodhana Chikitsa. Vedana Shamaka Aushadhi Dravyas are given. Analgesics, Vedana Shamaka. What one can do Ayurveda? Laghu Panchamool Siddh Peya. Laghu Panchamool Siddh Peya can be given. Then Kulath Haridra Kwath for oral drinking purpose. Kulath means horse gram and Haridra Kwath decoction can be prepared. Then Sarvanga Svedana can also be advised. Okay. So my dear friends, this is, I think, today it is quite enough that about Garbhastrav and Garbhapat. So I am very much thankful for your nice cooperation. We will see tomorrow for the Balaroga type of the class. But till then, I request, please share this video, like this video, and don't forget to subscribe my YouTube channel. Thank you very much and see you tomorrow evening at 7 p.m. Thank you.